নমস্কার, আমি ডক্টর পারিজাত দেব চৌধুরী, consultant interventional cardiology. Today I'll be talking about cardiac diseases. Cardiovascular disease is one of the most common cause of morbidity and mortality among people in India. And among cardiac diseases, there are various disorders. It can be ischemic heart disease, can be cardiomyopathies, can be structural heart disease, arrhythmias or conduction blockage. But ischemic heart disease is the most common cause which causes mortality, and early diagnosis is very important. So we should know about the symptoms. The symptoms of ischemic heart disease are usually chest pain, palpitation, shortness of breath or fatigue, and sometimes it can be silent angina also, like in diabetic patient. If ischemic heart disease can be detected early, then we can start treatment and the mortality can be prevented. And the diagnostic measures are usually ECG, echocardiography, treadmill test, and if needed, we will be doing coronary angiography. Coronary angiography will give us exact amount of stenosis in the coronary vessels, and if it is very significant, we can proceed with coronary angioplasty. Coronary angioplasty is life-saving in case of acute heart attack like STEMI, and this is one of the most challenging procedure to do, but at the same time it is very satisfactory also because it prevents death in the patient. We regularly do permanent pacemaker here. Permanent pacemaker is very useful in patients who are having complete heart block and who are presenting with syncope, also various type of AV dysfunction, and also in some other patient with sick sinus syndrome. ICDs also we are doing regularly, and the indication is usually VT or VF post myocardial infarction patient, sometimes in heart failure patient or DCM patient who have very low ejection fraction, and a typical ECG feature we do CRT implantation to improve the morbidity and mortality of this patient. So all this complicated procedure we are doing regularly in MRI Hospital Mukundapur, and we are planning to extend this to all the other people who are in need, and hopefully in future we will be able to reach more and more people and treat them properly so that cardiovascular disease related morbidity and mortality can be prevented. Thank you.